Okay, picture this. You're in a hospital setting. Maybe it's you, maybe a family member.
Hmm.
And there are people everywhere, different uniforms, different jobs. Information's flying around. Appointments, directions, maybe test results.
It can be overwhelming, definitely.
Exactly. And you have questions. Important questions, right?
Yeah.
About health, about the care itself. Who do you actually ask to get a reliable answer?
Yeah, and how do you even know if the care being provided is, up to scratch, meeting high standards?
That feeling, that uncertainty, that's really what we're digging into today.
Yeah, this deep dive is all about healthcare quality and safety. We're looking at the systems, the standards,
The support structures that help hospitals meet those standards.
and crucially, for you, how to navigate all of this, how to find accurate medical information when you really need it.
So for this, we've pulled together insights from a few key places. We looked at big accreditation bodies, like Joint Commission International JCI,
That's the global one.
right, and NABH, the National Accreditation Board for Hospitals and Healthcare Providers in India.
We also dug into the role of healthcare consultancies, using suprematic sources as an example of how they support hospitals.
And maybe the most practical bit comes from sources with titles like Ask Medical Professionals, not non-medical staff. Really direct advice there.
Very direct. So our mission here is pretty simple. Help you understand these layers, from the big picture global standards down to, who exactly you should talk to in the hospital.
It's about making you feel a bit more empowered, more informed when you're interacting with the healthcare system.
Definitely.
All right, let's start with those standards. Quality and safety in healthcare. It's not just a nice idea, right? There are formal systems behind it.
Absolutely. There are organizations whose whole job is setting the bar, defining what good, safe care looks like. And internationally, Joint Commission International, JCI, is a huge name.
Our sources really position them as a global leader.
They do, and their mission is, well, it's pretty ambitious, to enable and affirm the highest standards for everyone, everywhere.
Wow, okay, so how do they actually do that? Is it just rules?
It's more than rules. They offer accreditation programs for entire hospitals, yeah, but also specific things like clinical care programs or even telehealth now.
Interesting.
And they set these really rigorous international standards, things like the International Patient Safety Goals, specific actions hospitals have to take. Plus, they offer advice, training, resources to help hospitals actually meet those standards.
So they're not just grading the homework, they're kind of helping teach the class too.
That's a good way to put it. And their reach is significant, working in over 70 countries, accredited or certified over 1,000 programs. It's a big deal for a hospital to go through this.
I bet. And the sources mention benefits for the hospitals that achieve it, right? It's not just bragging rights.
No, definitely not. The sources cite things like better teamwork and communication inside the hospital. That's huge for patient care.
Makes sense.
Also, a competitive edge, increased community confidence. Basically, people trust the hospital more, and it helps with managing risks, reducing errors.
And it helps build that culture of safety we hear about.
Exactly, getting everyone thinking about patient safety all the time. JCI even talks about a vision of zero harm and highly reliable care. That's the ultimate goal they're pushing towards.
Zero harm, that's aiming high.
It is. Now, bringing it to a national level, let's look at India, for example. There's NABH.
The National Accreditation Board for Hospitals and Healthcare Providers, part of the Quality Council of India.
Correct. Their job is basically to set up and run accreditation programs specifically for healthcare organizations in India, setting those benchmarks nationally.
So similar idea to JCI, but focused locally.
Pretty much. They have functional autonomy but work with the industry, consumer groups, government, all the stakeholders. And like JCI, they offer accreditation, training, and define the standards.
Okay, so we have these bodies, JCI globally, NABH nationally in India, setting the standards, the expectations. But, I mean, a hospital is a complex place. How do they actually implement all these detailed requirements?
Good question. That's where the next piece fits in. Healthcare consultancies. Think of them as, well, expert guides, maybe. Helping hospitals turn those standards into reality. The suprematic sources give us a window into this.
So they do more than just help fill out the accreditation forms.
Oh, way more. Based on the suprematic info, these consultancies can be involved from the very beginning, like hospital design and planning.
Wow, right from the ground up.
Yeah. And then crucial stuff like recruiting doctors and nurses, getting the right team in place.
That's fundamental.
Totally. Then implementing quality management systems, the very systems needed to meet standards like NABH. They also help with procuring complex equipment.
Like what kind of equipment?
Things like specialized operating theaters, they call them modular OTs, or the systems delivering medical gases, that's MGPS, or even just general medical gear, making sure the hospital has the right tools.
So the physical stuff, too. Infrastructure.
Yeah, exactly. And the process is helping write standard operating procedures, or SOPs, analyzing how efficiently departments are working, implementing the big hospital information systems, the HIS, the digital backbone for records, scheduling, everything.
Okay, so these consultancies are like system builders, helping hospitals fine-tune their whole operation, people, technology, procedures, all aimed at hitting those quality marks.
That's it, precisely. They help hospitals not just prepare for accreditation, but actually build better, safer ways of working day to day. It's a really important support layer.
Got it. So standards bodies set the goal, consultancies help build the engine to reach it. That covers the system. But let's shift focus now, right down to the individual level. Your experience.
Yeah, this is where it gets really practical. And this brings us to that critical point from the other sources. Who do you actually trust for medical information inside the hospital?
This is the ask medical professionals, not non-medical staff part.
Exactly. And the message couldn't be clearer. If it's about medical advice, diagnosis, treatment, anything like that, you have to talk to a qualified medical professional, not the non-medical staff.
It sounds straightforward, but like you said, hospitals are busy places. It might seem easier to just ask whoever's nearby. So let's be really clear. Who counts as non-medical staff here?
Okay, based on the sources, these are people essential for running the hospital, but without clinical training for medical advice. Think receptionists, admin staff, people in billing, ward boys, or hospital attendants, maybe customer service reps.
The people who help with appointments, directions, paperwork.
Precisely. They're vital for operations. The hospital wouldn't function without them. They keep things moving.
But they aren't trained in medicine.
That's the key distinction. And this is why relying on them for medical info, even if everyone means well, is risky. The sources spell out several dangers.
What are the main risks they point out?
Well, the biggest one is just the basic lack of medical knowledge. They aren't trained for it. A source gave an example like asking a receptionist about a medication dose. If they guess wrong, that could be incredibly dangerous.
Yikes. Yeah. And that obviously leads to miscommunication or misinformation.
Absolutely. They might misunderstand you or pass along something inaccurate they heard. Best case, it causes confusion or anxiety. Worst case, you act on bad information.
And there's the risk of them going beyond their role.
Yes. Overstepping boundaries, that's a big one in the sources. Non-medical staff shouldn't be interpreting lab results, guessing at diagnoses, recommending treatments, or even suggesting over-the-counter drugs. They might want to help, but their opinion isn't a substitute for a professional clinical judgment. It could be totally wrong for the patient's situation.
And asking them could actually slow things down.
Right. Critically, yes, it can delay proper medical advice. If you spend time asking, say, an attendant about a change in your loved one's condition instead of finding a nurse or doctor who knows the case, you're losing valuable time. The sources really warn against that.
So it's about getting the right info fast from the right person.
Exactly. Plus, there are risks around unsafe practices, they aren't trained for procedures, and obviously, giving medical advice without a license has legal and ethical issues. But for you, the patient or family member, the core danger is potential misdiagnosis or getting an ineffective treatment plan.
Like panicking over results you don't understand, or maybe brushing off something serious because someone unqualified said it was nothing.
Precisely. It's relying on lay opinion over professional expertise. And that undermines the whole point of having trained professionals.
Okay, the risks are crystal clear. So let's flip it. Who are the right people to ask? Who should you actively seek out for medical information?
The sources are very direct here. Your number one go-to is the doctor or physician managing the patient's care. They're trained to assess, diagnose, treat. Ask them about the diagnosis, treatment plan, symptoms, medication details, dose, side effects, interactions, all of it.
They hold the big picture. What about the day-to-day questions?
That's where nurses and medical assistants are key. They work closely with doctors, know the protocols, and see the patient frequently. They can answer lots about medications, procedures, post-op care, discharge instructions. They're often your first point of contact.
And for medication specifics?
Definitely the pharmacist. They are the absolute experts on drugs. Dosage questions, side effects, interactions with other medications, or even food, ask the pharmacist. It's their specialty.
What if you just feel lost trying to navigate the hospital system itself?
That's where patient advocates come in. According to the sources, they can help you find your way, understand your rights, and importantly, point you towards the correct medical professional for your specific question.
Okay. And getting copies of records, like test results.
Yeah.
Medical records department for that.
Yes, you can get the documents from the medical records department. But, and this is a crucial but, the sources emphasize you need a healthcare provider, like a doctor or nurse practitioner, to interpret those results for you. Don't try to figure them out alone or ask non-medical staff what they think the numbers mean. Context is everything.
That makes total sense. So, know who to ask. But it's also about how you ask, isn't it? To make sure you get clear information.
Yes, absolutely. The sources have some good practical tips for communicating effectively with medical professionals.
Like maybe thinking through your questions beforehand.
Exactly. Be clear and concise. Know what you want to ask. List your symptoms or concerns specifically. The source gave a good example. Instead of something feels off, try, I've noticed my loved one feels dizzy after starting this new medication. Is that a common side effect? Specificity helps them help you.
Much more actionable for them. And remembering everything later can be tough, especially if you're stressed.
So true. That's why they recommend. Take notes. Just jot down key points, instructions, answers during the conversation. It really helps later. You can even ask if recording is okay, though policies differ.
Good tip. And what if you think of something after they leave, or you're still unsure?
Follow up. Don't ever hesitate to ask for clarification. If you don't understand something about the care plan, the medication, the condition, ask again. It's vital that you feel clear. Good professionals want that too.
Okay, this ties it all together nicely then. We have these big organizations, JCI, NABH, setting high standards for quality and safety, the framework.
Yeah. Then you have support systems like the consultancies we talked about, helping hospitals actually build the capacity, the staff, the processes, the tech to meet those standards.
Yeah, and then right there at the bedside or in the clinic room where you interact with the system. Your safety, the quality of the information you get, hinges on knowing to go only to qualified medical professionals for medical advice.
It's the critical link, isn't it? All the systems and standards in the world can be undermined by misinformation at the point of care, even if it's well-intentioned.
So every role in the hospital is important for making it run.
Absolutely. They all contribute.
But for medical advice, diagnosis, treatment info, stick to the people with the medical degrees and licenses. Understanding that difference is, well, it sounds like it's a fundamental part of being safe in the healthcare system.
It really is. According to these sources, it's not just helpful, it's crucial for safe and effective care.
So, by understanding the standards hospitals aim for and knowing exactly who holds the medical expertise you need, you're actually in a much better position to advocate for yourself or your loved ones.
You are. You're better equipped to make sure you're getting high-quality information and care. It gives you back some control in what can feel like a confusing environment.
Yeah.
And, that leaves us with a final thought to chew on. We hear about hospitals aiming for zero harm, building these complex systems and standards. How much does your active role specifically, knowing who to ask for medical advice and only asking them, contribute to making that zero harm vision a reality in your own healthcare journey?
It suggests it's not just about the system itself, but how effectively, how wisely we navigate it.